Thanks for joining us again. I'm here with Joel Fuentes, and we are going to talk about antioxidants and statin drugs. How about that?
That's right. This is a very important topic that we're going to talk about today. We'll let the audience know a little bit about the medications for cholesterol and also antioxidants.
So what are statin drugs?
So statin drugs are a class of medication that works on the HMG-CoA reductase inhibitor pathway. It helps to bring down cholesterol, specifically LDL cholesterol and total cholesterol. That's how they work.
And don't forget to look back at our previous videos when we talked about cholesterol and triglycerides. So we're kind of trying to tie all of this together. So if this doesn't make sense, please make sure you look, you go and view the other one. So exactly how does that work? These statin drugs, how do they work inside our body?
So, like I mentioned, they work on this pathway that allows to decrease the production of LDL cholesterol and total cholesterol on that HMG-CoA reductase inhibitor pathway. So the medications are prescribed by medical doctors, medical providers to bring down your cholesterol. So whenever your numbers are high, that's when a doctor reaches for their prescription pad to give you these medications.
How effective and what are some of these side effects that these statin drugs can cause?
So the effectiveness, when we look at relative risk versus absolute risk, the actual effectivity of effectivity are pretty poor. They're about less than 1%.
But they're so popular and widely prescribed.
Correct. Atorvastatin or Lipitor is the most prescribed drug in history, and it's basically given to most people that have high cholesterol levels.
I'm going to throw out this number because I read it yesterday as I was preparing, and Lipitor earns global sales, okay, this is globally, $140 billion a year. A year in sales.
Yep.
So that's a lot. Either we have too many people sick, too many people getting overprescribed, or, I mean, I think it's the latter of the two of what I just said, because I'm sure there's, and I will mention this shortly, there are other ways that we can prevent.
Correct.
From getting
the problem that we've seen is that the American Heart Association keeps on reducing the LDL number that we need to have. It's now down to, they want us to be at 100 LDL or less. Okay. So that's why this medication is prescribed. They're trying to bring it down, even down to 70 LDL. So basically, everyone will be put on a statin medication if they keep dropping the ideal level.
So to you, well, what would be that number then to avoid having to be prescribed?
Well, here's the thing. There are studies that actually prove that people that their LDL is less than 160 have a higher risk of suicide, have a higher risk of accidents. Probably the main reason or mechanism is because we need cholesterol in our brain.
Which we mentioned in our last video. Our brain functions on, what was that percentage?
25%.
Perfect. So we need it.
Correct.
And so if these requirements are lowered, you know, every year or every 5 years when studies, you know, move these requirements, if it keeps getting, you know, lower, then
everyone will be on that medication. Here's another thing. All-cause mortality is actually higher in people that are less than 160 LDL. So why are we pushing to bring LDL numbers down low?
And not only that, when you're on these meds, there are a lot of side effects, at least from, I know you've seen this more as a medical provider, you know, me as a nutritionist working, you know, at clinics and helping people modify their lifestyles. I always had patients complain about muscle soreness, muscle aches, joints, feeling fatigued.
Correct.
And many times it was the side effect of the medication, and patients were so not just concerned over if the medication is causing that, but they didn't want to stop taking it because their doctor had prescribed it, and according to them, the risk outweighed the side effects, and so they continued taking it. But then once they were taken off or weaned off of them, and then we incorporated antioxidants, natural antioxidants, they started feeling better. But there are side effects to these.
Here's the reason why it's concerning with the side effects. So like I said, this medication works on the mevalonate pathway. And what this pathway does is it not only produces cholesterol, which is the thing that the medication is supposed to bring down, but it also reduces coenzyme Q10, which is a very important antioxidant vitamin too in the body. In fact, your muscles need it, your heart needs it. So when we reduce the coenzyme Q10, you have the fatigue, you have the muscle aches, you have cramping, and a list of other side effects, including even memory loss. Why? Because we're reducing the cholesterol that's in our brain.
Well, there are studies, and we can probably talk about these later, but there are studies underway right now that are putting these two, they're associating the use, high use of the statin drugs to Alzheimer's or dementia.
Correct. Actually, they some medical doctors in the literature have named this medication the medication that makes you forget. So you're starting to forget things, and you're starting to see those side effects with these medications.
So we're given, doctors are giving this medication and not telling patients, but also change your lifestyle, when really your lifestyle changes, your eating habits are actually going to help you more than the statin drug is.
It's because of all those side effects. I'll tie this in as well as a side effect. In that mevalonate pathway, we also need that to produce testosterone. So when the testosterone drops with the use of the medication, even our sex drive goes down.
Well, we know hormones are derived from cholesterol,
so
from fat.
We need those fats to produce the hormones, the testosterone, the estrogen, the progesterone, cortisol, all that. So it's very important.
So now that you've given us this, how important it is to testosterone and other hormones, right?
Correct.
How can or what can people do to avoid being put on or prescribed a statin drug? Yeah.
Well, here's the thing. When we talked about a video previous about the lipid panel, what your doctor checks: total cholesterol, HDL, good cholesterol, LDL, quote unquote bad cholesterol, and triglycerides. In that panel, I had discussed how the important two factors in there are just HDL and triglycerides.
Correct.
So basically, where we're concerned when it comes to heart disease is to lower the triglycerides by decreasing the sugars and increasing the HDL by eating good fats and exercising.
Which, again, we have videos on that where we clarified what is the good, bad, and the ugly of those. So
correct. So basically, what ends up happening is that we need to look at the lipid panel a different way. We focused a lot on LDL, but really the type of LDL is the most important part. LDL type B, that's the small, dense LDL that gets oxidized real quickly and starts to damage the lining of our arteries.
Is that where we see on the panel the VLDL?
Correct. That's a very low density lipoprotein, so we need to focus on that one. And usually when your triglycerides are high, you will see VLDL being higher because sugar is actually what's causing those very low dense lipoproteins.
So we need to avoid the excess amount of sugars,
correct,
obviously, and then trans fats, which are not the good fats that we discussed, and you find these a lot like in fried foods.
Highly oxidative. So we have to stay away from those trans fats.
Right. So make sure that you avoid those to continue avoiding being placed on an statin drug. But there are other forms or additional things or supplement you can take if you happen to be on a statin drug now, and if you haven't been not prescribed or recommended to take CoQ10, then this would probably be the time to, included with your statin drug, but ideally we want to not be on it and or wean ourselves off of
the
it.
medication. Now again, talk to your medical provider about this. You know, we're not giving medical advice, we are giving the information.
Right.
But basically what happens is in the mevalonate pathway, we need that pathway to produce the coenzyme Q10, which is an important nutrient and actually works as an antioxidant as well. But if you are on a statin medication, you must take a coenzyme Q10 because your levels are going to be really low, because in that pathway that medication, the statins work on, your body will not be able to produce the coenzyme Q10. So
And what would be the recommended dose per day?
about 200 milligrams twice a day would be a good
So
dose.
up to 400 milligrams per day. So
Correct.
there you have it. Hopefully this video was very insightful for you on, again, an additional topic to the cholesterol that we've been talking about, which is part of these risk factors. So join us again next time, where we are going to discuss something else that is correlated to this, and we'll talk about antioxidants and how they benefit us. Thank you.